Thank you for choosing Morristown Medical Center to help you welcome your new baby. Whether you're a new mom or expanding your family, our obstetricians, neonatologists, nurses, pediatricians, and the entire support team in the Deskovic Maternity Center are ready to assist with a safe and comfortable delivery. Our state-of-the-art maternity center is clean, comfortable, and equipped with amenities for every birth plan. Morristown Medical Center is also home to a Level 3 regional NICU to care for premature babies and/or high-risk pregnancies. To keep all our moms, dads, and support people safe, we've created this video to introduce you to our award-winning maternity center and team in lieu of an in-person tour. If you have any questions, our patient experience liaison is available by phone or email. As you are preparing for your childbirth at the hospital, we have a list of recommended items to make sure you bring for both mom and baby. After the initial delivery period, most women prefer their own items. There are also essential items that you must have in order to take the baby home. It's best to plan ahead. And remember, you will have to have an approved car seat before discharge. When your labor begins and your obstetrician has instructed you that it's time to head to the hospital, your support person should drive to Morristown Medical Center and drop you off at the main hospital lobby on Madison Avenue. They should park the car in the east garage, directly to the right from the main entrance.
We will validate your support person's parking throughout your stay.
A health assessment will be performed at the main entrance for everyone entering the hospital to screen for COVID symptoms and other infectious disease. This will include a temperature check and standard questions about symptoms, travel, and contact with sick people. Upon entering the hospital, you are required to wear a mask at all times, including in your room. All Atlantic Health Team members will wear masks at all times. We strongly encourage you and your support person to practice hand hygiene by washing your hands frequently and using the gel sanitizer that is available in your room and throughout the hospital. Once you have been screened, you will proceed through the main lobby to the Simon elevators and take the elevators down one floor to Level A, to the Labor and Delivery Unit. This is a secured unit, so you must ring the bell for entry. Upon arrival to Labor and Delivery, our team will make sure your registration is in order by checking you in at our front desk. Pre-registration paperwork is available upon request to make your registration process more efficient. Please bring your photo ID and insurance card for the registration process. Your support person will be given a security band at this time. All patients can designate one healthy support person to be with them for the delivery of their baby and their postpartum stay. Doulas are currently permitted as part of the patient care team and do not count as a support person, but this may change. Please contact your provider as your due date approaches. We are following NJDOH guidelines for COVID-19 testing in our maternity centers. Please contact your OB provider for details 2 weeks prior to your due date, as these are subject to change. Women who have scheduled C-sections or scheduled inductions will have a COVID-19 test done prior to the procedure and quarantine from the test to their admission. We encourage designated support people and doulas to get tested independently prior to the childbirth, but it is not mandatory.
All patients who test positive for COVID-19 are placed in isolation in private rooms.
Our maternity center has a designated labor and delivery triage area. These designated triage rooms help our care team members tend to all of our patients' needs during the various stages of their entire pregnancy and labor. Based on the physician's orders and the patient's medical condition, some women in labor might utilize a triage room first for labor evaluation, while other women will go directly to a labor and delivery room. After registration, you will be brought to your designated room, where you will meet your nurse and other members of your care team. They will go over your prenatal history and admission questions. To To ensure we have all of your necessary information and for your safety, you may be asked some of the same questions you have already been asked. Your nurse will take your vital signs, draw any needed lab work, and connect you to fetal monitoring to assess both mom and baby. All our rooms in both labor and delivery and mother-baby are private and include a bathroom, shower, and place for your support person to sleep. All labor and delivery rooms have supportive laboring tools available like birthing balls, peanut balls, birthing bars, birthing stools, mirrors, relaxing music, and more. We have 4 labor and delivery rooms with built-in birthing tubs. Tub rooms are available on a first-come, first-served basis. A portable tub can be made available in other rooms upon request and availability. Speak with your provider prior to labor if you are interested in using the tub. We have wireless monitoring and intermittent monitoring available during labor to allow for more flexibility in movement. Its use must be authorized by your healthcare provider and can be implemented after at least 20 minutes of traditional wired monitoring in the bed. During your prenatal care with your OB provider, talk to them about pain management options and birth preferences. Our maternity center has a dedicated anesthesiologist for the unit 24/7. If you are having a scheduled cesarean section or C-section, you will advance to the preoperative area after you have registered. One designated support person is allowed to attend in the operating suite. Our labor and delivery is equipped with 3 operating suites. Our pediatric and neonatal teams are present at all C-section deliveries. We are a baby-friendly certified facility, which means we encourage certain practices, such as approximately 1 hour of skin-to-skin contact on mom's chest right after childbirth once you are both deemed stable. This can be wonderful bonding time. If you have had a C-section, skin-to-skin can take place after your surgery. After that, the medical team will do standard baby checks right in the room with your family, including height, weight, footprints, and measurements. Baby will also get their security band at this time. Should your baby need closer observation and care due to medical concerns, he or she may go to our newborn nursery or transfer to our NICU. Most moms move to their recovery room in the mother-baby unit about 90 minutes to 2 hours after delivery. All mother-baby postpartum rooms are private and include a bathroom, shower, and place for your support person to sleep. We will supply you with all of your postpartum and perennial care bathroom needs. Room service menus are available during your stay with plenty of options in an extensive diner-like menu. There are no set meal times. Just call down when you are hungry and the food is made to order. This menu can meet any dietary or allergy restrictions, as well as personal preferences. There are snacks and nourishment on the unit at all times. The hospital also has a Starbucks and cafeteria that is accessible. Before your discharge, you can order a picnic-to-go cooler for you and your support person to enjoy once you are home. The cooler will be packed with sandwiches of your choice, snacks, drinks, and something sweet. Let us take away the stress of your first meal at home. For your support person, we have built-in banquettes in our rooms for staying overnight, including all bed linens. Upon arrival to the mother-baby postpartum side of the unit, one of the newborn nursery nurses will come to your room to complete your baby's measurements and assessments. Your pediatrician will be notified of your baby's birth and will come to visit in the next 24 hours. If your pediatrician does not have privileges at Morristown Medical Center, we have pediatric hospitalists who will come to see your baby during your stay. They will then discharge you into the care of the pediatrician of your choosing. Your mother-baby nurse will care for you as a couplet. Rooming in with your baby is encouraged to support bonding with your baby as well as the many other benefits unless otherwise requested. Pediatric visits, baby's first bath, consultations, baby's blood work, and other supportive services can all be provided at bedside. If you wish to breastfeed your baby, our nurses are highly trained and able to assist you. We also have lactation consultants who are available on an as-needed basis for additional support. Once you've been transitioned over to the mother-baby postpartum side of the unit, your nurse will sign you up for a complimentary postpartum massage by one of our integrative medicine therapists. This will help you relax and recover. Another service that will be offered to you while you are on the postpartum unit is a complimentary newborn photo session with a local photographer. They will automatically be checking on you to see if you are interested in this free photo session. You can later determine if you would like to purchase the photos. Hospital-grade pumps are available for your use while you are here and are also available to rent from our parent education department when you go home. Before you go home, we will give you all the education you need, as well as resources and products to help you be confident and informed new parents. After you go home, we will still be here for you. Call us if you need us, and consider joining us for lactation support groups and other ongoing postpartum education. We have a warm line available to you for lactation support during your entire breastfeeding journey. Congratulations, and thank you for entrusting us with your care. Morristown Medical Center is focused on providing a safe and comfortable childbirth experience for all of our moms. Some amenities may not be fully available as we address COVID-19 in our communities. We appreciate your support and wish you all the best for your growing family. Please contact our patient liaison with any and all follow-up questions by emailing or calling her. We are here for you. Any footage in this video with team members, patients, and support people who are not wearing masks were obtained prior to COVID-19. This does not reflect the universal masking requirement, which is in place for every person in our medical centers.